Welcome everyone to Ovarian Cancer Canada's speaker series, The Evidence on Movement and Exercise for Ovarian Cancer. My name is Marianne Follis and I'm the Programs Associate with Ovarian Cancer Canada, and I'm pleased to be here with you tonight as your host. I'd like to begin by acknowledging the Indigenous peoples of all of the lands we are on today. While we gather virtually, let's take a moment to appreciate the importance of the lands we each call home, and to reaffirm our commitment and responsibility in improving relationships between nations, as well as our own understanding of Indigenous peoples and their cultures. I'm excited to introduce you to our speakers this evening, starting with Dr. Nicole Culos-Reed. Dr. Culos-Reed will be joined by TLC sisters, Dr. Melanie Keats and Victoria Schuteze, in just a few minutes. Nicole is a professor of health and exercise psychology in the Faculty of Kinesiology, adjunct professor in the Department of Oncology in the Cummings School of Medicine, and director of the Health and Wellness Lab and Thrive Center. She holds a research associate appointment with the Department of Psychosocial Resources at the Tom Baker Cancer Center, Cancer Care, Alberta Health Services. Nicole's research takes a multidisciplinary approach to understanding and improving the quality of life of individuals living with and beyond cancer, developing, delivering, and evaluating physical activity programs to address the physical and psychological challenges experienced throughout treatment and into survivorship. As a health behavior change researcher, Nicole is passionate about building capacity within the fitness industry to safely and effectively support individuals with cancer to live well and move more. Thank you for taking the time to be here with us tonight. Nicole, I will turn it over to you.
Thank you, Marianne. Thank you for having me over in Cancer Canada. It's a privilege to be here, and I look forward to sharing with all of you that are on the webinar this evening some information that we've built in exercise oncology. So I'm just going to pull up my slides. Someone can give me a thumbs up so I know that they're viewable.
Looks great.
Perfect. Well, again, thank you for having me this evening, and I look forward to starting off the conversation, but then really turning it over to the experts, Dr. Melanie Keats and Victoria Schuteze. And so I'm going to start us off with just a couple of disclosures and my bias, really. And so I am the co-founder of Thrive Health Services. You're going to hear a little bit about this in our exercise oncology programming, because it is the resource that we use to train our qualified exercise professionals. But I think more importantly is my bias, and that's that I firmly believe that exercise is medicine. And the quotes you can see on the screen here aren't from me. They're from colleagues actually in Australia who have worked really hard to advocate for and embed exercise within standard cancer care. And what they're stating is really based on the thousands of studies, the years of evidence showing the impact of using movement, of using exercise as a prescription to enhance the wellness of individuals living with and beyond cancer. So what I'm going to do is briefly overview that evidence and then suggest what we need to start to do to move evidence to practice. And it's really about addressing this typical gap that we see of taking research findings and making them actually applicable to the population that they're for. And then I'm going to talk about the resources you can access, educational, support for exercise behavior change, and the intervention that we have available across Canada, the Excel study. Before I begin, I want to just situate this, and you're going to hear me using these different terms, but I want you to think about where you are in any sort of movement, whether you engage in exercise, whether you don't engage in exercise, but you do move, you get up, you can walk, you can move around, or whether that's even limited for you. We're talking about often exercise when we think about our studies and our interventions, but I want to reiterate that all movement is beneficial, even below what we advocate for in our exercise oncology specific guidelines. And the evidence we have comes from thousands of studies that have been conducted over the last 30 plus years, really. And that evidence clearly shows that exercise is safe and beneficial for all those living with and beyond cancer across the entire cancer continuum. So we have studies in prehabilitation, getting people more ready for treatment. And then the bulk of the research is really across the treatment and into immediate post-treatment phases, as well as longer-term survivorship phases. And then finally, probably the fastest growing area right now is looking at individuals who are living with cancer, often an advanced cancer or a non-curable cancer. And really the role of movement, of exercise to enhance wellness and overall quality of life in that population by targeting functional well-being, physical well-being, and emotional well-being. Now, if you look at this evidence, this summarized table is taken from the American College of Sports Medicine Exercise Oncology Guidelines that really collated all the evidence and said, okay, where do we have strong evidence and what's the prescription? Where is moderate evidence and then where is it weaker? And you can see here we have a host of symptom-related, physical functioning, mental, emotional well-being, and overall health-related quality of life, where we already have very strong evidence for an exercise prescription that will optimize these outcomes. Likewise, there's growing evidence, we've listed as moderate evidence, for the role of exercise in bone health, so bone density, and for sleep. Now, I didn't put up the rest of the table that goes into where the weak evidence is, but what I want to point out is that we gather and we build up to this strong evidence and then this moderate evidence, not because exercise may not be as strong for bone health or sleep, but because it hasn't been as well studied yet. And the same can be true for areas where we see there's really weaker evidence, right? So it's just a matter of more outcomes being studied across really well-designed interventions or studies for us to understand then what is the optimal exercise prescription. Now, in that research, most of it focuses on breast cancer. That's the #1 studied population. And there's hundreds of studies. And then you have prostate cancer and colorectal cancer and lung cancer, head and neck cancer. And then I did a quick search. Okay, well, what's out there specifically for ovarian cancer? And this was the latest review that I could find published just a couple of years ago. And it looked at the 34 studies. So we've got hundreds to thousands of studies in breast cancer, and only 34 studies that really looked at the role of physical activity and exercise in women with ovarian cancer. Now, the good news is what this research found is that across the board, different types of interventions, different types of exercise, different durations or prescriptions. But what they found was that physical activity, movement, and or exercise was both safe and feasible. So women were willing to engage in it and showed some beneficial outcomes, but there was a lot of variability across the findings. What this review really clearly highlighted was that future work has to evaluate targeted interventions that can accommodate the disease-specific challenges that women with ovarian cancer face to ensure that we can use those findings to translate into improved ovarian cancer care by using the role of physical activity or exercise. Okay, so right now to date, it's been really pretty generic exercise interventions that have been used and not a strong consideration on, what are the unique challenges, symptoms, concerns faced by this population and how we might target that more effectively. In addition to this evidence-based research, there's also large epidemiological studies looking at the association between movement levels, physical activity levels, and longer-term outcomes, survival outcomes. And the take-home message from this, there's a couple of recent publications. The take-home message is really that higher both pre-diagnosis and post-diagnosis levels of physical activity are associated with improved survival outcomes, so decreased chance of recurrence and mortality for at least 11 cancer types. So great news that we're starting to see more and more of that evidence. And you can see here pre-diagnosis physical activity for a number of cancers and post-diagnosis physical activity for a smaller grouping of cancers. What you might also note, though, is that we don't have this evidence in ovarian cancer. Okay, there haven't been the large enough sample sizes, the population health studies to look at this association. But, given what we see in the 11 cancer types where we see this relationship, fairly strong evidence because there are different mechanisms across these different types of cancers, and yet we consistently see this role of physical activity, of higher physical activity levels being associated with better long-term outcomes, that there is that strong potential this may hold true as well in ovarian cancer. So lots of evidence and lots of really strong, well-designed trials, randomized control trials. And yet in reality, we know that most individuals living with and beyond cancer are not physically active. They're not physically active at guidelines levels enough to accrue many of the health benefits, but many of them are not even physically active to accrue minimal benefits. So we've got this gap, right? This gap between what the evidence says and what's actually happening in practice. And so I'm going to switch focuses now. That's a really brief and high-level overview of our evidence. But what I want to focus on then is how do we start to address this gap, right? And the first step is really thinking about what exercise oncology resources are available, integrated into the cancer care system or available in the communities to really support this uptake, this moving of the evidence to practice. So the first step, and really I think if we think of anything maybe being standard of care in terms of exercise oncology, it is exercise guidelines. So the evidence has been pulled together. Number of different groups worldwide have come out with guidelines. And this one here is the latest guidelines from the American College of Sports Medicine. And these guidelines are very similar to Canada's physical activity guidelines. A little bit less for the aerobic with 90 minutes a week versus it's 150 minutes a week for most adult Canadians as the guidelines. Then we have 2 days of strength training and flexibility training on most days of the week. Okay, so this is a good starting point, I would suggest, in terms of resources. However, if you think of your own experience or of anyone you know, and whether they were physically active coming in, maybe they were doing way more than this already, or maybe they've come in and they've never been physically active or haven't been since they were a young child, right? And so this generic, here's our exercise guidelines for the entire population, it's a decent first step. It's not where we want to end up being, because we know if we rely just on this, we're not actually going to probably facilitate any behavior change. What we need to do is move beyond the guidelines, which also state these recommendations, to really this last point. And it's the same point that came out from that ovarian cancer and exercise review, that we can't just be generic. We can't just say, here's a one size fits all for all individuals living with and beyond cancer. We have to start to individualize and tailor our exercise prescription to meet the unique needs, symptom management, but also consider other factors beyond the cancer diagnosis. Things like their previous history, the amount of support they have to be active, that resource access. I mean, that's a big one that came up over COVID, right? What do people want to do, like to do, and what are their barriers to doing it? Right, so a lot of different factors have to start to be built in to go along with what you see here, the exercise guidelines, to ensure we can deliver a targeted intervention that's going to maximize potential outcomes and benefits for each and every individual. So a big thing that we have to do within this tailoring is start to acknowledge and work on the barriers that people face for being physically inactive. So number one barrier for all of us is lack of time. Right? We say we don't have enough time, or, oh, I would love to exercise, but I work, I've got kids, I've got this and that, and so I just can't fit it in, right? So that's a big one for lots of people. For other people, they may not have the motivation to be active. It's like, well, maybe I have the time, but I'd rather watch that next Netflix series, or I like reading. I'm a big reader. I love to sit and read my book, and I could probably do that all weekend and not get physical activity. Right? Others don't know what to do, a lack of ability. And this can become exacerbated if you then add on a cancer diagnosis and treatment negative side effects. And all of a sudden it's, I don't know what to do. And I actually don't know if it's going to be safe for me. And I don't have the support to do it. Right? So all these things can start building upon each other. Another really big one, especially as individuals are diagnosed with cancer and go through a system where lots of sense of control is taken away and you're thrown into treatments, and for good reason, right, to help you achieve the cure or to move well through living with cancer. But often there's a lack of confidence about what you do have control over or what you can do to be physically active. And so addressing these barriers is, I think, a critical part for helping us to move beyond just the exercise guidelines and inform better our tailored prescription. So when we are dealing with barriers and thinking about this within the exercise resources that we build, we really start to target individuals building the behavior change strategies or skills that they can then use to effectively start to address barriers like time management, like access, like building their confidence. These are the big ones that you see on the screen, right? So goal setting individuals smart goals, and really within our goals, considering the social support for those goals. So how is somebody going to help somebody feel accountable? How is somebody going to tap into maybe others to help them have that motivation for their goal setting? We deal with and help people build the skills for self-monitoring or tracking their behavior. And that means, teaching very simple things like scheduling it in to usual daily routines or weekly routines, making appointments with yourself, So just like you wouldn't miss appointments in the cancer care system, an appointment for wellness in your actual calendar. What does that look like? Whether it's a 5-minute walking break or a 60-minute Excel class like you're going to hear about. We do a lot of work on raising people's self-confidence by providing education and resources around what can exercise look like and what is it for you to do it and how does that work in your usual lifestyle. Okay, so a lot of pieces here that we work on and help people through education and through practical application, really develop these behavior change skills or self-regulatory skills so that they can manage the barriers and start to build in that habit of moving more. So a lot of resources when we think about moving from exercise prescription to giving people more education and more resources to start to build the habit of exercise and the habit of movement. I want to point out a couple, and these are all available for free through our educational website at Thrive Health Services. And you can go there, you can download, you can print it off at home. But I really want to advocate for our wellness manual, Thriving with Exercise, an excellent resource that's been built by experts to really tackle and provide some of the worksheets and information that you can really use to think about how does physical activity, how does movement or exercise fit into your lifestyle, along with other lifestyle behaviors like nutrition and stress reduction. Okay, and then beyond the manual, we have a number of infographics and worksheets to help you really build your movement or exercise habit. So a ton of free resources that you can just go and download, you can share with others. Hey, you can show your clinician in the clinical setting and suggest this might be something they want to provide in that setting as well. So lots of worksheets, for example, to think about how do you build more social support if that's what you're lacking, or what are some maintenance tips so I can get started but I just can't seem to stick with it, which is very common for many individuals. And what happens when a true barrier comes up, like all of a sudden I've got more appointments, excuse me, or all of a sudden I'm feeling sick, right? What can you do? How do you modify exercise so that you can still do some movement and not just have a full stop? So a lot of resources at thrivehealthservices.com. So these are all great pieces, I think, in moving beyond the, here's your brochure with your exercise oncology guidelines on it, to more tailored resources that can help people start to build the actual skills to facilitate seeing themselves as an exerciser and starting to build the habit of exercise. But the next step is really the most important one, and that's providing actual exercise class program resources. And these are some of the pictures of the group that we have here in our local facility, our Thrive Center, as well as, you know, what everybody pivoted to during COVID, and that's our online offerings. So I'm going to tell you a bit more about these classes, and in particular, the program that is available across the country. So I saw in the chat in the beginning people from different parts of the country, and I know our two speakers that I have with me here tonight are from different parts of the country. And so we really, as a research team, took a look at the success we'd had in Alberta with what is our Alberta Cancer Exercise Program and said, well, where's the gap? And the gap for us was bringing our Alberta-based program right across the country, and in particular, reaching people out of major urban centers. And so that's what Excel is, Exercise for Cancer to Enhance Living Well, a hybrid implementation effectiveness study that's meant to be exercise intervention in the real world, so available in your communities or, as the case may be, online. So Excel, like our other programs, it's not built specific for one cancer, it's for all cancers. People, again, living in more rural, remote centers or who don't have access to exercise oncology resources in a bigger center. Pre, on treatment, or up to 3 years post-treatment, adult, able to consent in English, able to participate in low to moderate activity. And I can tell you, we bring people in that have every range of physical activity that you can think of. The beauty of exercise, and when we tailor it to meet unique needs, is we can modify it to have a class where we've got somebody who has had literally no experience to somebody who's been running marathons. And we can accommodate all those bodies and all those different levels to ensure that each individual is getting out of the class what they need, because it's meeting them where they're at. Okay, the other piece around this for most of our sites across the country is access to what we're on tonight, Zoom. A little bit different though, because in our classes, it's cameras on for safety for the instructors to be able to see you. Okay, so that's the eligibility criteria. And Excel is first and foremost about the safety. So safe implementation, and then the effectiveness of the program. And so Excel runs with these hubs across the country. Alberta, BC is coming on board, Ontario, and Halifax, the Maritimes. And key position is the registered kinesiologist or the clinical exercise physiologist. So that is the individual with the appropriate level of fitness background and training, so degree and experience working in clinical populations, that we require to be able to effectively bring people into our program, screen them and assess them, and then put them into the right classes. So when you're in an online class, this is a screenshot you see here, and the top person here, this is Julia, who is a CEP in my group here in Calgary. She's teaching participants from all sorts of different locations here. Anybody that would come into Julia's class, lots of them are higher risk. So people on treatment, people with more advanced cancer, people with significant comorbidities that maybe need more CEP-led instruction. Other classes may be led by trained and qualified exercise professionals. So somebody who's a group fitness instructor or somebody who's a certified personal trainer. So not the CEP, but people that go into those other classes, we screen them to make sure that they don't need that CEP level class. Right? So safety first coming into our programs. And then after that, we're looking for benefits and for different outcomes. The actual Excel program is based on what we've done here for 20 plus years, and in particular, our ACE program over the last 6 years. So it's a 12-week program. It's group-based on Zoom for the most part, although there are some physical locations, in particular in the Maritimes. 2 classes a week, each is an hour long. It's free. It's funded by the research and by the funding agencies. And it's a circuit style program. So you get a little bit of aerobic activity, a lot of functional movement, resistance training, balance and stretching. And it's really tailored to meet each individual based on your baseline screening that you do before you come in. As well as the lead instructor, there's a secondary moderator who monitors for safety, can help adapt and modify, and they're there to help deal with the event of any adverse event. So again, it's safety first. So Excel received funding during COVID. Not great timing to try to start a new study, but we had the advantage of the planning to actually deliver it over Zoom. And so our first program started in fall of 2022, or 2020, sorry. And we, as you can see now, are up to almost 700 participants who have come into Excel. Over half of our participants are on treatment. And when I took a look at our database this week, we had 36 participants who have been diagnosed with ovarian cancer in this whole program to date. So relatively small percentage, and hopefully as word gets out and people maybe want to take a look at this and see if it's for them, we can see those numbers grow. Excel will be running for still almost 3 more years, 2.5, 3 years. And so our programs start every 12 weeks. So there's a winter start, a spring start, and then a fall start. So 3 waves over the course of the year. And you can see here that we've got programs across Canada led by QEPs. So that's our qualified exercise professional across different provinces and territories. And again, the only in-person to date have been ones that have been run out of the Maritimes with some small community-based programs there. We have these qualified exercise professionals who are able to lead these classes, so they receive extensive training in exercise oncology, as well as our study-specific training. So to date, really quite successful given all the barriers we faced with COVID, and we're really hoping that over the next few years, we'll see an exponential increase in participants in this important program. In addition to that exercise program, if you're listening tonight and you're like, I already do my own exercise, I just want a little bit more, or hey, I don't want an actual study, I want to just be able to do this when I want to do this. We have a YouTube channel on our website at the University of Calgary that you can access any and everything there for free. Okay, so Thrive for Cancer Survivors is the website. There's a YouTube channel link on our website. We have 8 weeks of our 12-week program. We've got webinars, some more education, but then there's all sorts of videos on here showing different exercises that you can do from home. So if you're looking for just, hey, I need more balance ideas or more core or more upper body, they're all in different categories, and there's variations to show you with weights, without weights, with bands, etc. So a lot of really great resources, all shown here with modifications by our qualified exercise professionals. And then last, I want to leave you with just a couple of practical things. So even if you're going out for walks, or you are going to the gym on your own, or you've been an athlete and you're used to pushing yourself, but you're not sure, okay, when I'm feeling like this, what should I do and how hard should I push? We actually don't like to use the word push. I was talking to that today with an undergraduate student. We think about, well, supporting you for wherever you are and what that support might look like if you want to go harder or dial it back. And so a really great tool to use is this rating of perceived exertion. And this one's actually got some older graphics and things on here that I should have updated, but essentially it's a 0 to 10 scale. It correlates really well with your heart rate, or if you've got like a smartwatch, I've got an Apple Watch on, and you can take your heart rate on this. But this is a nice tool just to start to monitor, okay, if I go out for a walk and I'm feeling kind of fatigued and not great, where do I want to keep it? Somewhere in that very light to light zone, and then see how my body reacts. On a day when I feel great, I've got energy, I want to push it a little bit, I feel like I can do more. Maybe I start light, but then I push it into a moderate or even somewhat hard, depending on my fitness level and depending how I'm feeling, right? So this can be a great tool because my 4, Victoria's 4, Mel's 4, somebody else's 4 are all relative to our feelings and our experiences. So this can be a nice piece to start to gauge, okay, 0, I'm not moving. Very light, I could keep doing this for a long time and I'm not going to. So if I push it up a little bit, what does that feel like? And get used to how does that feel and how does your body respond? And in particular, one of the tools we use a lot in thinking about how your body responds are these fatigue and energy thermometers. Okay, so we use these across a lot of our programs and classes, but again, just a good visual, a tool for you to think about when you're moving. And for many of us, but in particular, if you're an individual who's on treatment or going through different phases of your treatments, there's often that fatigue. And we know cancer-related fatigue is the #1 reported negative side effect across all individuals. And so monitoring your fatigue, and even if you're tired when you start to move, how do you feel during it? And then by the end of it. And typically what we've seen across many studies that we've done this in is that people will report high fatigue as they come into a class. And by the end of the class, the fatigue is lower. And likewise, low energy at the start of the class. And by the end, we see energy increase, right? So each and every time you move, whether it's a 10-minute walk at your lunch break, or it's get to an exercise class, or it's do a yoga online, you want to be monitoring that fatigue, and fatigue should always go down and be lower after movement, and energy goes up. And it might be a little bit, it might be a little bit more depending on what you're doing, but these are really good tools to ensure that you are paying attention, I guess, to your body and doing what your body needs on any given day, which can change on any given day. So to wrap up, Excel is the resource available, plus all of the online and educational and video resources that we've built through our website. Excel and all of our exercise programs are about tailoring to meet the unique needs of individuals wherever they're at. So we consider your previous experience, your current fitness levels, what equipment and resources you have at home, what you're going through if you're on treatment or completed treatment, and then beyond cancer, comorbidities or other issues. When we do that, we know we can modify exercise based on your needs to ensure that we're going to optimize the benefits for you out of any of these resources or programs. So these are some of the common questions we get asked, and we consistently see that when we have this communication with our participants, we're able to address their needs and ensure it ends up being a positive experience for them. But I don't want you just to believe me. So I'm going to turn it over to the experts, and we are going to start with my good friend and colleague, Dr. Melanie Keats.
Thank you, Dr. Culos-Reed, for sharing the research and information showing the relationship between physical activity and improving outcomes, and the importance of individualizing and tailoring exercise to our unique needs, and the resources to support us in reaching our movement goals. I'd just like to take a moment to share and introduce our two next speakers with Dr. Melanie Keats and Victoria Schuteze, who will share their experience with the Excel program. Having confronted cancer on multiple occasions, including stage 4A ovarian cancer, Dr. Melanie Keats, PhD, firmly believes that her ability to recover and maintain her health continues to be the result of her ability to maintain an active lifestyle. Recognizing the multitude of benefits associated with physical activity and exercise, Dr. Keats chose cancer research, or more specifically, exercise oncology research, to better understand how to maximize these benefits for all those confronted with the disease. Dr. Keats is a professor in the School of Health and Human Performance, Division of Kinesiology at Dalhousie University. She is co-chair of the Physical Activity and Cancer Care Standards Steering Committee in the Nova Scotia Health Cancer Care Program, co-director of the Physical Activity and Cancer PAC Lab, a senior scientist with the Beatrice Hunter Cancer Research Institute, and affiliated scientist with the Nova Scotia Health Medical Oncology. Thank you for joining us tonight, Mel.
Thank you, Marianne, and thank you, Nicole. That's a mouthful. So thank you for getting through all of that.
Mel, before you
yes.
get started, do you want me to take the slides down so that we're fuller screen, or?
Sure, sure.
Marianne, is that okay?
Sounds wonderful.
Okay, perfect. There we go.
Awesome. So I have to admit, my head is kind of buzzing. It always does after, and following Nicole is never an easy thing to do. But my head is buzzing with all of the different things, because with these types of things, I wear two hats. I have the researcher and the scientist and the work that I'm doing in this area that I'm obviously very passionate about, and which you'll see for very obvious reasons. But also as a survivor of cancer, and now most recently a non-curative diagnosis of ovarian cancer. So I know I'm in this this isn't something that's going away. This is something that I'm going to be dealing with for the rest of my life, and as well as someone that's lost members of my family to the disease. Cancer first became a part of my life before a time I even really recognized it. I was less than a year old when my brother was diagnosed and passed away of acute myeloblastic leukemia. He wasn't quite 4. So cancer's been a part of my life from pretty much day one, and it's had a huge impact. And I'm going to give the same kind of disclaimer that Nicole did to begin. I have a massive bias when it comes to exercise and physical activity. I truly and honestly flat out believe that the only reason I am still sitting here today in front of this group is because I've been as active as I have over the course of my life. And I'm not only talking physically, because the obvious physical benefits of physical activity and exercise are the strength, the energy, to do what you need to do, the jobs you need to get done during the course of the day and not be so exhausted that you fall into bed every night. To keep up with my daughter during the day, to engage in the activities that I enjoy that make my life, that give value and joy to my life. But it's the mental part. Like it's my social outlet. It's my network. If I'm feeling really crappy, if I can do something and be active, go out for a walk, play a sport, it takes me away from all of the crap that we're dealing with and all of the stuff that we have to work through over the course of our days. So I am, again, huge bias. So, and again, like I said, I'm really kind of bouncing back and forth as where do I start? What do I say? What do I talk about? Because there's so many things that when we talk about exercise and how it can impact the lives of those diagnosed with cancer, as well as their family members and support care persons around that. It's when we talk about cancer, it's not just the individual with the disease, it's the family, and it impacts everybody. And the family can benefit from, one, supporting the person with the disease by, saying, you know what, let's go for a walk. Because when you don't feel like moving, having someone there to support you to say, let's go for a walk, that helps. It makes it more of a social activity, and you can have a chat and connect. And half the time when we go to some of these classes, it's that social, you're exercising, but you forget about that you're exercising because you're kind of chatting and just visiting and just having a giggle and a laugh. And, you can, oh yeah, I was throwing up all, you can commiserate all the things that are going on and you can relate. So it's very nice to have that as well. So again, I'm kind of bouncing around because my brain can't sort of sit where I want to start, what I want to talk about. But I think what I'll do is I'll share 2 stories from my own personal experience, my most recent experiences. So ovarian cancer is my 3rd different cancer. So I've had 3 different cancers. Spinal cord cancer, I was told it was terminal, and I was pretty much given 18 months to live. I was 12 when I was diagnosed. Clearly, I'm still here, so I'm still kicking. When I was 17, I was diagnosed with bladder cancer. In my 20s, I had a benign schwannoma. So I'm not really counting that one as cancer, but it is something that was removed and that we had to treat and deal with. And then, of course, most recently, last summer, I was diagnosed with stage 4 ovarian cancer. So that's where I'm going to start my story, and I'm going to share 2 parts with you. So last summer, over the course of the summer, actually started, I guess, in the spring, I'm starting to feel unwell. And as many folks that are on the seminar, the call today, can very well relate. There was a number of different symptoms and things leading up to it. But one of the things that that really sort of resonates with me is a sense of fullness that I had. And over time, it just continued to get worse and worse and worse, to a point where any movement I did, if I was trying to walk my dog and my dog's like, oh, squirrel, and would drag me a certain way, the excruciating pain that shot through my abdomen, my body, was something that today I still can't explain how that felt. Walking and taking a step, each step I took was painful. I had so much fluid in my abdomen that had entered into my lungs. I couldn't breathe. So I would lay on my back, I would lay on my stomach, I would lay on my side. My mom and dad actually came home, I'm in Halifax now, but my parents came out from Calgary to help take care of me, and mom would help me with trying to massage my back and trying to get things so I could actually breathe. It was very, very difficult. I was very, very unwell. Finally, with the diagnosis of ovarian cancer, we were able to drain some of the fluid, and it gave me some relief. But during that time, and I have been a very active person my entire life, so not being able to be active during that and doing the things, I missed hockey, or I was missing hockey, I was missing baseball, I was missing playing with my daughter, I couldn't walk my dogs. All the things I enjoy and love doing, I couldn't do because I was in so much pain. So that joy, there was no joy. There was just nothing, there was no happy moments in my life at that time. But during that time, with my mom and dad in town, my mom has some issues with her knees, and she had actually gone out for her own to get a stationary bike. It was a great purchase, probably more for me than my mom, because what it enabled me to do is to be able to exercise pain-free. Now, when I say exercise, I mean sitting in a recumbent bike, moving my legs, no tension, no nothing, but it gave me something. It was anywhere between 5 and 10 minutes because the breathing was so difficult. I couldn't do very much, but I was moving again, and it gave me something that I could do to care for me. And that was more than anything at that time. That the value of that was immense, to be able to do that. Once the fluid started to come off, and the doctors drained the fluid, and with the chemotherapy, to keeping some of that fluid off my body, I was gradually able to do more and more. But during that whole first treatment period, I was so unwell. I just continued to lose weight, continued to lose muscle mass, and I got sicker and sicker and sicker. So by the time my 6th round of chemotherapy came around, I was completely and totally wiped out. And it took me a very, very long time to recover from that. But I did. So my last treatment, it was in January of this year. And by the summer, I was back playing baseball. I was, playing hockey and doing different things, loving it. Felt great. I felt like me again. I wasn't quite where I'm getting older too, so I have to take that into consideration. So I'm still not where I once was, and I have to admit that I probably never will get back there. But just being able to play again for me has been such a huge benefit. Unfortunately, I found out this late August, early September this year, that the cancer is back. This time it showed up in my lymph nodes. So I'm back on treatment. But the difference between being back on treatment today versus starting treatment last year when I was so ill, I'm so much stronger that now that when I go into therapy, so when I start my treatment, in my cycle, I was talking to the team prior to this, but I say, so my treatment cycle starts on a Thursday. Friday, Saturday, we talked about this, we kind of had a laugh about this, or my steroid days. I feel great. I'm feeling like I'm on top of the world. It's all artificial, it's all medication, but I still feel great. So I just go crazy on those days. I probably should moderate that a little bit, not to go too crazy. But then Sunday, Monday, I feel really wiped out. That's when the medications, I'm weaning off the medications, and I feel really wiped out. And then I start to rebuild again. But the difference this time is I went into treatment much stronger. I was able to rebuild my strength. So I'm recovering from treatment much more quickly. So when I hit the Sunday, Monday, I'm very fatigued and I'm sleeping, but I'm still mobile. I'm still able to do things. I can still walk my dog. I can still go outside and do some of those things. I have to be careful and I have to temper what I do, because if I do too much because I'm not able to eat as much, I get very lightheaded, and I have been known to pass out. So I have to be very cautious with that and very aware of what those limitations are. But now because I have been going back to the gym and doing and working out and working on my strength and my cardio and my different kinds of things to stay strong. I'm finding by the Tuesday after, so what is that? 5 days after, I'm back at the gym doing what I more and more and more. So each day thereafter, I'm getting stronger and stronger. So the difference between when I was first diagnosed to now is night and day. I'm recovering much more quickly. I feel much better. I still have a couple of days where I feel really sorry for myself, but then I'm able to pick back up and get back into it. So I guess for me, the kind of the message behind it is what we do is going to vary from individual to individual. So when I was first diagnosed, my activity was 5 minutes maybe on a recumbent cycle. My exercise after chemo, after my first round of chemo, my exercise was literally getting out of my bed and sitting in a chair. That was my exercise. And if I could sit up for an hour, that was brilliant. Now it's a little bit different. So because I'm a little bit stronger, I'm able to do a little bit more. So I think we have to be kind to ourselves, and it's really, really hard for me because I have certain expectations. My brain and is telling my body that I should be able to do all the things I did when I was 20, let alone all the things before I had ovarian cancer. So being kind to ourselves, engaging our family in things, getting that support. So if we want to go for a walk, safety for me. I remember going for a walk after my first couple of rounds of chemo with my mom, and she's walking with her cane, and I'm walking behind her telling her to slow down because I can't go as fast as she's going. So there's all these types of little things that I remember going through. But activity has always been a part of my life. It always will be a part of my life. It's made a world of difference for me. And I'm really, really proud and very honored to be able to work with Dr. Culos-Reed. I did my doctorate with Nicole a few years ago, but we've been working together since. And I think we both have the same vision, and that's to make sure that any cancer patient and survivor that has a diet, or anybody with a cancer diagnosis, has access to an exercise program. And bottom line, it should be free, and it should be accessible, and it should be part of standard care. Everybody that wants it should have access to it. And that's really the goal. And the resources that Nicole has developed and put there, and Nicole said it's free. So if you don't want to be a part of the research, these are the resources, this is what's out there. Please make use of them. If there's questions, Nicole's got an awesome team in Alberta. We've got colleagues across the country that can support. Excel's a wonderful resource for folks that are interested in that. But yeah, so I mean, I could talk forever and ever and ever, but what I'd like to do is to pass it on to Victoria, because Victoria's engaging in Excel. Maybe she can give you a little bit of sense of what she's benefiting from the program as well.
Thank you so much, Mel, for sharing your experience with us and the importance that movement has played within your journey. It is my pleasure to introduce Victoria Schuteze. Victoria is 42 and married with 2 teenage daughters and has an awesome husband. She works a job she loves to read, cook, crochet, scrapbook, and play video games. Her dog and 2 cats are always within a few feet of her, no matter what she's doing. So Victoria, will pass it over to you.
Hey, thank you so much. And honestly, I never know how to follow up to people like you just heard. And I'm not going to actually say much to you that you haven't heard from the last 2 people, but I just wanted to pop in tonight. And when Melanie asked me if I would join and come and talk about my experience with Excel, it's really an easy yes for me. I do not have that bias. I did not have it growing up, but I do now. Excel honestly has been one of the best parts and truly the most beneficial of my entire cancer experience and recovery. Rewind back into my teens and early 20s. Exercise was really important to me back then. Of course, we want to keep that slim teenage physique. Somewhere along the way, though, I lost it. Between work deadlines and raising my kids, not enough sleep, not prioritizing myself, not making the time for that. It was just lost. And the habit was broken. And last year in July of 2021, I was diagnosed with stage 3/4 ovarian cancer. I went through a lot of the same symptoms that Melanie was describing, like the fullness and the pain and the discomfort. And I was massively out of shape. I was working very, very long days at the time, like 20 hours a day. my body was tired. And I wasn't sleeping well and I wasn't eating well, but I wasn't just physically tired either. I had anxiety, I had depression, my self-confidence was completely in the toilet. Nothing worked the way that it should. And then add a cancer diagnosis on top of it. It really, kind of the cherry on top of the cake, as you say. But with this diagnosis and, treatment that came after, whilst my body was technically becoming healed, I was becoming so much weaker at the same time. I mean, I couldn't even go for a walk. I mean, heck, I couldn't even go up the stairs in my house. If I missed something, that was it. I couldn't dress myself without taking a break. I couldn't take a shower without taking a break. Couldn't even get myself out of the bath. I honestly never thought I would feel strong again. But I can tell you, honestly, that is just not the case. I've been out of chemo for 7 months now. I'm feeling very strong. Thank you very much. Despite being diagnosed with a recurrence, which I was, but I'm moving my body. I'm running around. I'm playing with my kids. I play with my dog. I'm speed cleaning. I can do all kinds of things. And the biggest thing I can attribute that to is my work with Excel. So, the benefits that I've gotten from the Excel program so far, these physical improvements. So before you start the program, they do a baseline test. And during my baseline test, I couldn't touch my toes. There was inches from the end of my finger to my foot. I can touch them now. I can actually grab them now. I can wash my feet in the shower now. Not only can I go up and down the stairs, but if I forget something at the bottom, I can go right back up to the top and grab it again. I'm sleeping great. I feel well. And just a funny little anecdote I hope you enjoy, but a few nights ago, my 12-year-old daughter came up to my husband and challenged him to this squatting contest. And she said, you can't go all the way down keeping your full foot on the floor. And she tried it and fell over. And my husband said, well, of course you can do it. It's not possible. The body doesn't work that way. She couldn't do it. He couldn't do it. I could do it. So that's progress. And I can completely attribute that to Excel as well. We're doing all kinds of squats all the time, and getting a lot stronger. I will also say it's helped a lot for me with pain management. So between the surgery last year and all the inactivity of the last year, I had a ton of back pain, lower back pain, pain along my sides, neck pain, mostly gone now. I would say easily 90%. I still have little aches and pains, don't we all? I'm getting older. But for the most part, it's not the same nagging, persistent, uncomfortable pain. But it really isn't just physical improvements either. We all know the facts. Exercise releases endorphins. We feel happier. We feel more satisfied with life. We sleep better. But we also get that sense of accomplishment. You're doing your last breathing exercises at the end of your hour workout. Hey, I did this. Like I actually did this. And it's a pretty incredible feeling. There's also that social aspect too. So I've been with a group where I think my trainer said the first female only group. But it's been pretty awesome, I will say. I've been able to bond and learn with all the other participants. We keep each other accountable. It's like a date with wellness. We give each other that camaraderie. We laugh together and we sweat together. My program actually ends tomorrow, and I'm going to miss my whole group. I'm going to miss my trainer, and I'm going to miss all the team of ladies that I've been working out with. It's been really amazing, and I'm hoping that we're going to stay in touch. Like as we've heard about already, that exercise will reduce the chances of a recurrence. Of course, that doesn't apply to me. But again, I already had my recurrence when starting Excel, so I'm not evidence in the other direction. But it's definitely made me a much stronger person for the upcoming chemo. And I don't know when that's going to start, but I am going into it just a beast compared to where I was at before. Tons of energy, physical mobility, flexibility, stamina, and strength exercises. And I just know that throughout all the chemo that I'm about to endure at some point soon, I know that I'm going to be stronger throughout and keep going. And so, it's really not just elongating my life, but it's going to give me a better quality of life all the way through too. And something that was touched on as well earlier is that I'm learning skills and learning habits that I didn't have that are going to last with me too. So, during my workday now, like lots of us, we're working at a desk or we're sitting down or we're, sitting for longer periods, but I can take a few minutes to stretch. And now I have 12 weeks worth of what I would like to call like little microcycles of exercises where I can sit down and I can do, just 5 minutes of stretching. Something that I learned before signing up for Excel, a few minutes of movement is better than no minutes of movement. And so even if I just take 5 minutes every couple hours and stretch my arms and move my legs and do a few of these things that I'm learning, I'm still feeling better at the end of my work day too. And so if you're like me, there was a bunch of things that you were thinking, and I know that they were already previously addressed, but let me say, I was right there. I was thinking, first off, I'm too tired for exercise. What are you trying to get me to do? I actually remember coming home before my chemo started. You have your visit with the oncologist, they give you the paperwork, and they were trying to tell me that I had to exercise through my chemo. And I remember thinking, wow, that sucks. Like, here goes my plan to just sleep through the whole year. And that was all I was going to do and not feel any of the pain or discomfort side effects they're talking about. Whatever, I'm going to sleep through that. I'll just take lots of medicine. So I'm too tired for exercise. You know what? Just show up, try it. We've all heard that the research actually gives you energy. I can tell you it's true. I know it seems counterintuitive, but you will get a second or third or 25th wind just from getting up and moving your body. Or if you're feeling like it's too expensive and you don't have the equipment, you don't need anything for Excel. That's one thing about the program that's actually really, really amazing is, a chair is helpful, sure, to hold on to for the balance exercises. I know I still need that sometimes, but, and you need a screen that you can join the workouts with, but really you is all you need. If you have other stuff, the trainers will work with you on it, and that's great. But there's nothing necessary but your own body and just a willingness to move. The nice thing about that too is that it's portable. There's nothing more portable than your body. So if you work at an office and you squeeze in these 12 weeks and you do this thing and you just want to do a few movements when you're, on a ferry or, well, not on a bus, but waiting for this, that, or whatever at work, you don't need to pack resistance bands and weights and a, treadmill or whatever else you have. You're learning how to move your body and how to exercise just with your own resistance and your own strength. If you have health issues that are preventing you from doing this, go for it if your doctor allows. I mean, obviously, I'm not a doctor, so I can't speak to individual cases, of course, but what I can tell you just from witnessing and experiencing this program is that these trainers are amazing. They're super educated. They're super compassionate. They're really, really creative and lovely, and they will work with you no matter what your concern is. Saying, I can't handle these types of movements or these types of movements. They always show us a few different variations, and it's kind of up to you which one you do. And then they watch us to make sure that we're moving correctly and in a safe way, and that we're going to be well, which I think is just really cool. Everybody in our group, there's vastly different body types, different diagnoses, different treatments, different abilities, different strengths. And there's even people like at every different stage of treatment. And my trainer, I won't name her, she knows who she is, and I hope she sees this. She always works with everybody. And it's really actually quite an incredible experience in that way. Very, very inclusive. And so, I guess what I have to say probably sounds gimmicky, but I can promise you it's not. Coming from this person who was so stagnant last year to somebody who just feels like super vibrant about moving my body and about being physically able and feeling a million times better, just try it. Show up. You'll see it's a great workout for your body, but for your soul and your mind too. You'll reap the rewards as you go through the program. And I just want to say a huge, huge, huge thank you to Dr. Keats for letting me join the program and for having me along the ride, and to my trainers and to my team too, all of the participants that showed up in my group, and just for coming every week and sharing this experience with me. And it's been nothing short of awesome. So thank you so much.
Thank you so much, Victoria, for sharing your experience with Excel. I think I really appreciated how you take the learning from Excel and that you're applying that, and that you'll continue to apply that when you're done the program. And I think that that's really important as we, for all of us, as we continue to go forward with every day. I just want to thank again all three of you for being here tonight. And we do have a couple of questions that have been shared in. And if anybody on the call has additional questions, please feel free to add them to the Q&A box at the bottom of your screen. We have a couple of minutes left that we can answer some of those questions for you. Our first question is targeted towards Dr. Keats. And so the question is whether you had surgery as part of your treatment plan, and maybe you can speak to how your exercise helped you recover from that as well, if that was part of your treatment plan.
Yeah, so I did have surgery. So I followed this, what at least out here, everybody sort of affectionately refers to as a sandwich protocol. So I actually started with 3 rounds of chemotherapy, which was really difficult for me to wrap my head around, because I was told that what we would do is, because the tumors were fairly large and, when we discovered them, but that we would start with chemotherapy to shrink the tumors as much as possible, then have the surgery so there's less surgical morbidity. So meaning that they would have to take out less, they would be less aggressive, they could be potentially less aggressive with the surgery than if I had done the surgery right off the bat and then followed with 6 rounds of chemotherapy. So yes, I did 3 rounds of chemo. I had a little bit of a break to recover, let my counts recover, and then surgery, recovered from surgery, and then had 3 more rounds of chemo. Exercise wasn't, so I've been very fortunate. Everybody, the oncologists, the gynecological oncologists out here are very, very supportive of exercise, and we're actually working with them on another study for ovarian cancer patients that we'll be starting next year. But so they're very supportive, but it wasn't really a formal part of my care plan. It's always been a formal part of my care plan, like when I take care of me. And it's kind of fun in a way to kind of mess with my docs when I say these are the things that I want to do, because they always look at me like I'm a little bit crazy. But they are very supportive. So when I say that I want to be active and do different things, that yes, they support it. And because it's kind of different for me, because I work with many of the oncologists that actually treat me. So I have like a dual relationship with them. So maybe that wasn't a formal discussion because they knew who I was and they knew what I did. They just assumed that I would sort of take over my own care plan and do that. But yeah, so it's difficult because I wasn't able to do a lot, but I did manage and try to do as much as I could, because again, the stronger we can go into surgery and to chemotherapy, the more quickly we can recover. So, and that's one of the things specifically we want to look at is what we, if we can start programming and offer tailored program to women that are on treatment and anticipating surgery. Can we use that time while they're on chemo, waiting for surgery, to build up their strength as much as we can? Because when they have surgery, the stronger we go into it, the quicker we recover, and with the fewer complications. So after my surgery, I was out of the hospital on day 2 post-surgery. The docs came in and said, go home. They were thinking in the beginning, they said, you could be in hospital 4 days, 5 days, 10 days. We'll see how it goes. Day 2, they asked me if I wanted to go home. I'm like, I'm out. So those are the kinds of things that's what we're trying to work for, and using that as a means to, one, stay strong and being as strong coming in and out of our treatment as we can.
Wonderful. Thank you so much. Our next question, I'll actually see if Dr. Culos-Reed would be willing to answer it. There's a question around, is there a similar program for those who live in urban areas such as Ottawa?
There are different resources across different areas. I know we have had participants in Ottawa that have taken part in Excel because they don't have access to anything within a reasonable distance, either online or in person. So we do, we'll take calls from anybody, and then we'll screen and we'll look at our database to see what resources exist. So if you don't know of anything, call us. If we know of something that's closer to you, we'll refer you to that. But otherwise, our criteria allow us to also take individuals in who simply don't have access to exercise resources, and they could be living in bigger centers.
Wonderful. Our next question is around the individual shared around pleural effusion and how that makes exercise challenging. So like we said, we do encourage you to speak directly to your healthcare team to know what is best for you in your particular case. But perhaps our panel can speak to the customization that happens during the Excel program to help the participants get the most out of the program.
And Mel, I don't know if you want to take this one on based on personal experience as well?
Yeah, and I think this is one of the questions that was submitted a little bit early, and it's a brilliant question. From the researcher science side of things, there's no literature on pleural effusions in women with ovarian cancer. The next closest thing relative would be probably exercise for people with lung cancer. So when you have like this, when you have difficulty breathing and catching your breath, exercise becomes very, very difficult. And when you have the fluid from your abdomen get into your lungs, it becomes that much. You just can't take a deep breath. So exercising becomes obviously far more challenging, but becomes more about movement. So for me, from my personal experiences, there's no way I could go for a big long walk or a hike or do any of those kinds of, that was just not, it just wasn't feasible for me. So it's moderating that and tempering that back to what can I do and what is safe to do. So if I went for some walks, but they were very calm, level, easy kind of walks with a support person. And then riding the stationary bike. So if I got tired or fatigued, I was sitting. I wasn't going too far from that position. So I was able to moderate or adapt the activity to what I was capable of doing. Is it safe? Is it something that we can't? I think what you're going to find is it's going to be self-limiting. You're going to know what and how hard you can push through that, because your body's only going to let you do so much before you start coughing and things. So it's really about being observant and understanding, and to echo what Marianne, what you said, it's individual. So I think first and foremost, we have to convey to our clinicians and our oncologists to say, look, I would like to start doing more. I know there's a fluid, and if you're waiting for the paracentesis, or you're waiting to get that fluid drain, what's safe for me to do? I think within your own limitations, your body's going to pretty much dictate what you're going to be capable of doing. But there is, that deep breathing, if you can, I think that's helpful. Just as far as symptom relief, it's not going to reduce the fluid and the pressure. That's not going to wait until someone releases that for you. But yeah, so I mean, from a evidence point of view, I don't have a lot to sort of stand on to say this is what we've seen and these are the benefits and this is how you can best tailor. It really comes down to everything that we talk about. Is you've got to make it right for you and what works for you.
That's great. Thank you so much. We just a one, maybe we'll finish up with one more question, just looking at the time for tonight. One of the, it kind of is along the same lines in terms of the level of exercise or athleticism that somebody has prior to their diagnosis. Are there programs or research out there that are targeted more to people that had a higher level of activity in their life prior to their cancer diagnosis? And if so, would you be able to share any of the resources, research or programs that would address the need of that population?
Yeah, that's a really good question. And I'm not off the top of my head familiar with a specific study, for example, that recruited just individuals who had been elite athletes or anything like that. I can tell you from experience, we've had everybody into our program from somebody who literally has never, ever exercised in their life to triathletes. One of my original study protocols actually was based on a man who had summited Everest, got cancer after and couldn't get out of a shower. So he was just like, no way. So we had our climb back from cancer protocol. Right. And for him, and I think what I've seen over the years in working with different populations is that it's often harder for people who had more prior experience because they have to learn how to dial it back. And no one wants to hear this is the new normal. That's annoying. Right. And so it is, it's a different mindset, but it's what Mel just spoke about. And I always say this in my support group talks. I probably didn't tonight, but number one, you're the best expert in your body. So like Mel said, you're going to read how it feels for your body, and it's about listening to your body and giving yourself grace. So on days when you feel great, you go for it, and days when you don't, you give yourself grace. And so that's one key element. And the other is it's not the Jane Fonda era of no pain, no gain, right? And often the athlete mentality is push, push, push. we need to dial back from that and think about, how do I support so this feels good while I'm doing it, and I feel good after. We don't want that rebound fatigue after either, right? So no pain, no gain, throw that one out the window and listen to your own body. But yeah, there's not, other than, like, I think of the dragon boat research that's out there. So women pulled into a team environment, but it's not necessarily that they were athletes or active before, but there's work by Dawn McKenzie from UBC on those training protocols. And, you know, they trained them like athletes and showed no increased risk of lymphedema in that population of mostly breast cancer. I know there are ovarian cancer dragon boat teams as well. And so maybe some of the training protocols there look more like, you know, kind of traditional athletic athlete type of training. But I think the beauty of exercise is we can tailor it. So if someone comes in with a ton of experience, we can see where their body's currently at and work on to where do they want to get to, what feels like a good place for them, and like vice versa. If somebody's had zero experience, we start right where they're at and see where they want to get to.
That's wonderful. Thank you so much for sharing that information. And that is all the time we have for our session here this evening. And I just want to again thank Dr. Keats, Dr. Culos-Reed, and Victoria for being here tonight with us, for sharing your experience and expertise, and for all of you that have been watching for joining us here tonight.